Without further ado, we're going to jump right in. I know you are a big advocate for safe healthcare systems. How do you think that we can go about creating a safer healthcare system?
Well, first and foremost, I would like to say thank you, Brianna, and thank you to NurseDeck for having me here this afternoon from my side and this morning from your side of the world. In terms of creating a safer healthcare system, from my perspective, I think there's a lot of factors that comes into play when we talk about building a safer healthcare system. So, to mention a few, I think firstly, healthcare organizations must adopt a safety culture. And when I say a safety culture, leaders should establish safety as the highest priority. And I think this should translate into having policies and procedures that focus on safety in all aspects of the healthcare services. Another factor would be establishing a body that oversees safety. So in the organizations that I've worked with, we do have quality and patient safety department, and this team of individuals, they set some metrics or key performance indicators that they usually monitor to measure the risks, so that we will be able to see if something is not going well, and then we can manage it at an early stage, thereby preventing harm from happening. Also, we can use technology, and I think a lot of the organizations have been utilizing technology to build a safer healthcare system. So for example, having an electronic prescribing system that helps prevent prescription errors, or having automated barcoding systems that helps in preventing medication administration errors. But as a nurse educator, I would say that one of the main building blocks of creating a healthcare system is ensuring that you have a competent healthcare workforce. Because when you have a competent healthcare workforce, it then translates into having high quality and safe care. Because if you have nurses or like physicians or allied healthcare workers who have the skills, the knowledge, and the attitude or the ability to provide that safe care, then for sure the care that will be received by the patients will be of high quality and be very safe.
Yeah, I think that's so true, and especially about the automated systems coming into play. I have a follow-up question there. How do you get nurses to buy in to some of these systems that they may at the bedside view as tedious? Like, I get the barcode, it prevents medication errors, but it's so hard to rip open the package, or I can't get the patients, people will skip steps. So how do you get the buy-in at the bedside from nurses, understanding how important it really is?
Yeah, to be honest, initially when and I think this is true to everything that you do when there's a systems change, it's quite difficult initially to get the buy-in. But then I think as they see that there has been an improvement in the care that they provide, the errors have been minimized, and I think this is where the metrics are important, because you can then let them see that there is actually data that can prove that whatever you're doing right now is actually effective. It protects the patient, and it also protects them as healthcare professionals, because if they commit medication errors, for example, from this side of the world, well, they will their licenses can be canceled and they can be sent home. So
big repercussions. I think that's so true. I think seeing the metrics again, like when you see the numbers, there's no refuting that, and you want to be a part of that. You don't want to be on the other side of those statistics. Tell us about being a Sigma Nightingale Challenge Scholar. What does that mean? It sounds very exciting and important.
Oh, it is quite exciting. And honestly, I just heard about it last year, and because I joined the second cohort of the Sigma Nightingale Challenge Scholar. And I would say that it was one of the best experiences that I ever had as a nurse. It's one thing to be a member of Sigma Theta Tau, because this is the second largest nursing organization in the world. But being a Sigma Nightingale Challenge Scholar gave me a whole new perspective as a nurse, as an educator, and as a leader. The Nightingale Challenge helped me clarify my vision and mission as a professional, because before I think we all do set goals, but then sometimes like for me, I never thought of setting a specific vision or mission for myself. But then when I joined Nightingale Challenge, that was one of the things that we really looked into, having that vision and mission. And I was also able to have a proper personal and professional branding, which I think is very important, especially for us nurses who would want to teach or would want to educate and who would want to influence other nurses as well. I think another thing with the Sigma Nightingale Challenge was that it gave me the opportunity to be mentored by seasoned nurse leaders, who are known experts in their respective fields, and they have given me access to a lot of resources to build my leadership skills, to build my education skills. And aside from that, I think one of the best thing was having the opportunity to network with amazing and dedicated nurses all around the globe.
Yeah, they say you're a accumulation of the 5 people around you that have the most influence on you. So I can only imagine being in that environment. It must have been very motivating and inspiring.
It is. And funny enough that you mentioned that quote, because I'm usually listening to this podcast every morning, and it's the same quote that he said that you are the average of the 5 people. Mm-hmm. Are you listening to Rob Dial as well?
No, but I've heard that in other. I like that message. You know, it really shows the influence of people around you, that in all the ways that you may not really be picking up on. So
true.
Pay attention to that. Going back to the very beginning, how did you get your start in nursing? And what advice too would you give to new nurses just starting out?
Okay, so starting as a nurse, before I started as a nurse, I was actually scared to be a nurse because I'm scared. Yes, I'm scared to see the sight of blood. Like when when I was first exposed into the operating theater, I fainted because when they sliced, I was like, "Oh my God, it's blood!" But yeah, I think when I started to fall in love with it, and then when I finished the nursing school, I started as a nurse volunteer at a small community hospital within the district where I live. But then, and I think this is quite different 13 years ago because there were a lot of supplies of nurses back then. So what the hospitals were doing back home before is that if I want to work in a hospital to gain experience, I have to pay them instead of them paying me. So so that's why I was like, okay, I'm just gonna go for a volunteer job. And then starting in a community hospital is quite challenging in a way because I have to learn to be creative and innovative to make sure that I deliver a reasonably acceptable level of care. Because in a community hospital, we do have very limited resources. And then I think after a year, I moved into a larger hospital in the neighboring province. And then I started as a medical surgical nurse and then moved into the ICU. And it was a different experience as well. I think I struggled more on, because that hospital was a big hospital, so they do have good resources. But then the challenge for me was having to deal with very critical patients and the difficult working dynamics initially as well with my seniors. You might have heard of this quote or this culture of seniors eating their juniors. So
we talk a lot about that.
So initially when I started, that experience was really quite real. But then it helped me, I think, become a better mentor, preceptor eventually, because I realized that I don't want to have that experience. So I don't want that experience to be relayed to the new joiners as well in my unit. So eventually that went okay. And then in 2013, that was the time that I migrated to the United Arab Emirates. And the struggle was also different because, you come to a different country, it's away from home, it's a new environment, and the culture was very different from where I come from. And of course, the language is also different. And I didn't have a background on how to speak the Arabic language. I could not understand them. So it was initially a bit challenging.
Yeah, sure.
But then eventually, I was able to conquer all the challenges. I think those difficult experiences that I had as I progressed in my career, I would say that it helped me become the nurse that I am now. And I would say that I am stronger and more resilient in terms of, or if I compare myself 13 years ago when I started. So I would say that my advice for the new nurses who are just starting out, particularly for those who are starting now, because as what we all know, this time in our healthcare history is so challenging. um, I would advise everyone to make sure that you look after yourselves. And by that I mean you look after your physical, your emotional, your mental well-being, because if you are well holistically, then you are equipped to face whatever challenge that comes your way.
Yeah, I love that. I think that's such an important message, and we hear it so much right now. I think it's easy to tune it out a little bit, but it really is so important, and it's such a foundation for to care for others. You have to first care for yourself. I mean, it's just true, you know.
Exactly.
Yeah. And going back to a point you made too about nurses, we say nurses eat their young, which a lot. I mean, I experienced it to some degree myself, and I think even if you haven't experienced it, most nurses are very familiar with that type of culture. But you'll be glad to know we do a poll for some of our members and spotlight different nurses, and that's always a question we ask them in a true or false setting. And most nurses are answering false now. So I think the trend is slowly shifting a little bit, which I'm happy to see that people are just like, no, we're not putting up with this anymore. And leadership is stepping up to really back up these new nurses coming in, because we need them, we need
Yeah,
these new
exactly.
nurses. Yeah.
I think it has come a long way in terms of that, nurses eating their young. Yeah. So
Yeah.
I'm glad that the culture is changing.
I hope so. At least based on our little viewpoint of the world, it is. um, and speaking of NurseDeck, what do you think a community like NurseDeck can be great for nurses today? A virtual community as opposed to real life.
Personally, I actually believe that having a community like NurseDeck, it's not just great, but extremely beneficial for nurses today, because this is a community made by nurses for nurses. And for me, NurseDeck fosters a community, a spirit of community, which provides a sense of support and belongingness. I've been in contact with some members of the NurseDeck community, and the support that you get is actually very, very good. It's enormous.
Yeah.
And aside from that, NurseDeck provides an international platform that showcases the great and amazing work done by nurses.
Yeah.
And I think what you are doing is actually beneficial in the sense that it elevates the image of nursing around the globe. And with this, you are promoting respect for the nursing profession, and you are actually encouraging nurses, the young nurses, to pursue nursing itself. And I actually would like to commend your team at NurseDeck for starting this community of practice, and for showcasing the nurses that can, that nurses can do a lot of things, by featuring them in your magazines and your websites. Because as what I said, I believe that the things that you do actually provide the motivation for our young nurses, for our budding nurses, for our student nurses. And it gives them an avenue to see the significant impact that nurses can give, not just in their immediate environment or their community, but even in an international level.
Yeah, great. I'm so happy to hear that. We really strive to show nurses. I mean, I think most nurses know there's so much you can do with a nursing degree, so many different directions you can go in, but it's hard to imagine yourself there, or you don't really know the path you could take to get to the certain different specialties or career options that are out there. So we're really trying to connect those dots for new nurses or nurses that are just looking to change up what they're doing now. So, and to just kind of stay curious about the whole thing. It doesn't end with nursing school, as you know. You can always.
Exactly. I totally agree with that. And even for myself, to be honest, when I started my nursing career, I never thought. Well, I loved education since the beginning of time, but then I never thought that I'm gonna go into the educational pathway, because when I started, I was more in the leadership pathway.
Yeah.
And then something happened in my career here in the Middle East, which then give me that rerouting into the education pathway. So things can change, but then, for example, with what you have in NurseDeck, because you have the experiences shared by other professionals, I think it will give an idea to our new nurses that it's okay to change. It's okay not to stick to just one pathway, especially in nursing.
Right. I agree. And I think that draws a lot of nurses in as well. You know,
Exactly.
they want to do it. It's just the how of doing it sometimes can be intimidating. So sort of making those little stepping stones along the way, I think, is helpful. So I think interviews like this, and when we get into all the different certifications that you've gotten, you know, it just opens up a whole new world for your career. As far as advancements in healthcare, what advancements in healthcare would you like to see being developed? Do you think it will help in nurse retention, nurse burnout that we're all experiencing right now?
In terms of advancements, you know, there's a lot of advancements that we can see nowadays. So for me, it's difficult to really pinpoint a specific advancement that I would want. But I would say, you know, if it happens in the future, I would really love to see an innovation that would help minimize the administrative or the non-clinical tasks for nurses, so
Yeah.
that they can focus more on actual patient care and, you know, increase patient contact time.
Yes.
Um, as what we've mentioned earlier, we've seen a lot of technological advancements in healthcare, and some of these advancements, instead of making nurses' lives easier, sometimes they make them more difficult instead, because they will usually take you away from the bedside. You have to deal with a lot of inputting data and information into the computer and stuff. So yeah, I believe that if this administrative task, if this non-clinical task can be minimized for the nurses, this would help nurses to have more time, not just for the patients, but also for themselves, which will then translate into a better quality of life while reducing the risk of actual experience of burnout.
Yeah, I think you hit the nail on the head with that. I think that's one of the biggest frustrations that nurses have, is that I spend more time, you know, on my computer, on my laptop, on my tablet, documenting what I've done than doing the things, you know. And nurses are people. So I think they want to be with their patients and making those connections. That's what sustains us and keeps us coming back more than a paycheck, I think, for most nurses. So
Exactly.
I
Yeah,
think
I agree.
that's such a true answer. And I know a lot of nurses feel that way. So I also think, do you think it's true that as nurses, we spend the most time in an acute care setting with the patient from, you know, the beginning of the shift to the end of the shift, whereas, you know, the patient may go off to different departments and to have different procedures done, but we're sort of the grab bag of documentation. So we end up documenting for a lot of other people as well.
I sort of agree with you. You know, it's really happening. Like even in my current workplace now, sometimes when other team members will not document what they have done, you know, we always say that things that are interventions that has not been documented means that it hasn't been done. So
Right.
because you just want to make sure that this has been documented, because in a way your documentation is also a way of communicating that things
Yeah.
have been done for the patient. So
Yep.
yeah, in a way I do agree that we are a grab bag for documentation. Yes.
Yeah. Right. The main, if a patient was a news feed, we create the timeline for
Yes,
sure. So. But,
totally agree.
yeah, but I think that's such a good point about cutting back on administrative tasks. Being a nurse educator, what knowledge would you like to share with other nurses? I know that's a big question, but if you could boil it down.
Yeah. So honestly, if there's an opportunity for me to share everything that I know, I would be extremely delighted to do that, because I really love sharing. And my mantra has always been to continuously develop myself, so I may help others grow through knowledge sharing.
Mhm.
And in fact, I seize every opportunity to do that. Like it can be informally when I'm doing my rounds and chat with fellow nurses, or formally through conferences and publications. But one of the main things that I would like nurses to keep in mind is that, as what you mentioned earlier, is that education and learning doesn't stop after you finish nursing school. So,
Mhm.
as a nurse educator, I always believe that learning is a lifelong process. You know, we learn new things every day, and seeing how dynamic healthcare is, there's always something new to learn.
Mhm.
So once, and this is my message for everyone, so once you finish your nursing degree and start working, don't stop learning and educating yourself. Try to explore the different competencies
Mhm.
needed for you to become a better nurse, and try to maintain or improve these competencies by attending relevant trainings, or going for certifications, or by using online resources like what you have in NurseDeck, for example,
Mhm.
to keep yourself updated on the recent trends in healthcare.
Yeah, yeah, I think that's such a good point. And I think it provides a sense of hope right now for nurses that maybe feel so utterly overwhelmed with just tasks that never seem to be able to get done at this pace. And if you have some sort of education aspect in your career, you're always kind of looking at the horizon. It keeps your mind moving forward, and not feeling stuck. So I love that, being a lifelong learner. I mean, I'm a big fan of that, but I think you put it beautifully. What was it like to be recognized as the Healthcare Professional of the Year for 2019 by the Filipino Times Awards? That's amazing. Congratulations.
Thank you very much. Honestly, it was surreal, and I still can't believe that I actually won that
Yeah.
award. Yeah, for me, it's already an honor to be nominated because there's a lot of, there are more than 30,000 equally dedicated nurses here in the UAE, the Filipino nurses.
Yeah.
And I was actually quite surprised when I heard that I was nominated, and I honestly did not expect to even reach the final deliberation, as
Yeah.
I was pitted against other distinguished nurses as well who have massive contributions to the Filipino nursing community here in the UAE. The deliberation process was quite tough, as we had to go through a battery of interviews, and then we have to provide a presentation on our initiatives. So when they told me that I was among the top three finalists, I was like, oh my God, I could not believe it. I was really surprised. And of course, I'm very grateful. And for me, being in the top three alone was already confirmation that I am making a difference through
Yeah.
what I do as a nurse
Right.
educator. So during the awards night, it was so funny because I was with my friend. I asked her to be my escort that night, and then while they are announcing the winners for the other categories, they started handing out the certificates of appreciation for all of us. So I thought that I did not win because I already received a certificate of appreciation. So
Oh, funny.
yeah, so I told my friend, like, after we will just wait for my category to be called for, and then after the winner will be announced, then we'll just have to leave
Yeah.
because I still have to drive back home.
Yeah.
And then so when they called my name on stage, I was like, oh my God, both of us were shouting because
Oh, that's so great.
we could not believe it. I was literally crying as I was walking towards
Oh,
the stage. Yeah,
that's
because
amazing.
yeah, it was just amazing. And then when I came up the stage, um, the person who gave me the trophy said that you know why we chose you. It was because the way you presented your initiative. It was a very good way of presenting. So
Yeah.
for me, it was an affirmation that I am a good presenter. I am a good educator, and the award itself, I think, was an affirmation that I am making an impact as a nurse and as an educator in my community.
Right. Yeah. I mean, because the message is part of it, but as you said, the delivery of it, you have to believe the person behind the message. That's
Exactly.
almost as inspiring as whatever information is coming out of your mouth. So, what an honor. That sounds like
And
an amazing experience,
it was
especially
an amazing
thinking you had
experience.
lost it, and then
I
again,
know.
you just had the biggest shock of surprise on your face.
Exactly.
That's great. What an awesome story. And then after winning this, do you go on to be a representative for the organization, or what do you do with it after you win this distinguished award?
So after I won the award, I have been given opportunities to share my story in magazines, and I've been tapped to speak in some conferences as well.
Yeah.
What I did was actually I used that. Um, I use that as a vehicle to share my story and encourage other nurses to continue pursuing what they are passionate about. Because, as what I've said earlier, my nursing experience here in the Middle East was not a walk in the park. There were a
Mhm.
lot of challenges. In a way, I was sort of like a victim of racism as well, because
Mhm.
being an Asian, being not Western trained.
Yeah.
So, but I did not hold on to that. I did not dwell into that. I tried to find ways that to show them that even if I'm not Western trained, even if I'm an Asian, I can actually do things as well the same
Yeah.
as they are, because we are all nurses. As long as, of course, you pursue continuing education, as long as you pursue improving yourself,
Mhm.
then you can do a lot of things. And
Yeah.
um, I think by sharing my story, I have motivated a lot of my colleagues as well to even pursue continuing education, which I'm actually very happy, because I think that's just what I want. I want everyone to continuously grow themselves, and
Yeah.
maybe be that drop of water in the ocean that creates
Right.
that rippling effect. Yeah.
Yeah. That's such a good point. I mean, motivating people. People study that for decades. So to be able to get the nuances of that through living your own life authentically, I think is an amazing achievement. You know, there's no award that you could be given to really be able to capture that. So it sounds like you've been able to do that, and it almost always, I think, involves going through hard times. You know,
Yeah, I think it
people
always.
relate.
Yeah, I think hard times usually give, in a way, for me. Well, my hard times gives me a different perspective in life. Um, it it somehow opened my eyes that life will never be yes all the time. It will not be very easy, and if you want to pursue something, you really have to work hard for it.
Yeah,
And yeah, and then if it comes as a no, then always think that there are other doors or windows that will open as well. Like
right.
it's not the end of the world if something happens.
Yeah,
If whatever you want did not materialize, you know.
yeah. That's so true. I think if you have that sense of agency, then the speed bumps that come along, you feel in control of them because you were expecting them, as opposed to just letting it derail you. Things that happen to you, you know.
True,
Um,
true.
yeah, I think that's a great point. Um, what in what way do you think that NurseDeck's community would be a great resource for nurses and nursing students? Any resources you think that we should focus on for nurses?
Well, firstly, I believe that NurseDeck's community would be a great resource for nurses and nursing students as it provides them access to invaluable resources. You know, so like having visited the website, you provide stories from nurses who are in the field. You
Mhm.
have insights on how to navigate and succeed in nursing school. Your website have um, some points on life advices, career guidance, which aids in personal and professional development, among many other benefits.
Mhm.
So, aside from that, it also provides opportunities for networking and linkages. And I'm actually very glad, you know, that the people in the NurseDeck community are so active in LinkedIn, even, you know. So we
Mhm.
usually network, collaborate with each other, and see what everyone else is doing to
Yeah,
progress the profession.
yeah,
So for me, that opportunity for networking and linkages uh, is very crucial in promoting the nursing profession. And as what I've said earlier, Nurse Tech provides or fosters a sense of being a part of a family, which is quite important.
right.
In terms of resources, well, there are a lot of resources, and I think it depends on what specialization you would want to.
Mhm.
My other suggestion would be you know, aside from the resources that you can get on the internet, maybe try to be a member of a professional organization because they do
Mhm.
provide a lot of resources that
Yeah,
is aligned with the pathway that you would want to.
yeah, I think that's good. We touch on some associations you can join, and then even nursing unions, which can be a polarizing topic, but at least in this country. But I think giving nurses the information that these associations are out there, and like you said, following your different passions in life. Usually, there's other people that are interested in that same topic. So,
True, true.
and advancing the career as a whole as a result of that. Um, tell us a little bit about the nursing certifications that you've pursued. How have they helped your career? Did you always have this idea, this goal that you wanted to have different certifications?
So initially, when I was studying, when I finished my BSN and started working as a nurse, I honestly did not consider postgraduate studies or certifications because I was having a hard time before balancing between work and having to study as well. But then when I started my postgraduate, like my master's in nursing, I think I went to a school who is, I think the environment of the school was just so nice and um, that because that school motivated me to continuously seek new knowledge in a way.
Yeah,
My professors there are very collegial and friendly and approachable as well, which really motivated me to just continue and pursue it, even if it was quite challenging. So eventually, when I finished my master's degree, initially it was a master's in nursing. I pursued another master's, which was more focused on gerontology nursing before I left for the UAE. And
Mhm.
then when I came to the UAE, I realized because in the Philippines, it's not very common to go for certifications because honestly, it's quite expensive
Yeah.
from the Philippine perspective.
Yeah, right.
So, yeah, because you have to pay for the certification, you have to go for review, you have to buy resources. So when I came in here, I realized that there's a lot of certifications that you can go to, or you can apply for depending on what field you would want to pursue. So I started applying for the certificate CPHQ, the Certified Professional in Healthcare Quality, because when I started in the Middle East, I was quite interested with patient safety and quality.
Yeah.
So I did that, and then eventually, when I moved into the education pathway, then I took the certified nurse educator certification as well.
Mhm.
On that process, while I was working here, I pursued my PhD in development education via distance learning from
Mhm.
one of the government universities back home.
Mhm.
And because for me, and I think this has always been my principle as well, that I would rather use my time for something that will benefit me in the long run. So, I missed all the weekend night outs with friends and all. But then I think whatever I did, it has benefited me. It has the return of investment in terms of
Yeah.
education has really helped me a lot in terms of my career progression. And one thing that I would like everyone to realize, especially for those who might not be familiar with certifications or obtaining certifications, is that it validates your knowledge and skills or expertise in a specific specialization. And
Yeah.
therefore, it provides you the opportunity to advance, and it also provides you a sense of confidence and achievement
Yeah.
with your field. And
Yes.
because this is a voluntary process, then it actually gives us a perspective that you as a nurse is committed to career development, and you are dedicated to patient care,
Yeah.
particularly in a changing environment. So I strongly advise all nurses to pursue certification in whatever field or specialty they are interested in.
Yeah. Do you think it helps too with salary negotiation? I think a lot of nurses are afraid
It
to even
does.
broach that subject, but I feel like it would
It,
help
it,
there as
it
well.
does help, yeah. So to be honest, I think in the Middle East it's a bit different in a way, but I've been seeing a change since I came here. So when I started here, there was not that much fuss about having a postgraduate degree or
Hmm.
certifications. But then eventually, because a lot of our hospitals here goes for international accreditations, like I think you're familiar with the Joint Commission International,
Sure. Yeah.
among many other accreditations. So they usually look into the qualifications of the people being placed in specific positions. So this has motivated people to go for certifications, postgraduate studies, and it does impact in the pay. So, for example, for me now, I'm being paid at a different level now compared to my other colleagues because of the certifications and the qualifications that I have.
Yeah. Yeah. I think it's a good bargaining chip to know your
Yes,
worth, like you said, that
exactly.
confidence that it gives you. That's
True.
great. Um, Competent care, you touched on that before, being a competent care provider. What does that mean to you? Why is that important to you? Why is it important for nurses as a profession?
Well, competent care is very important to me, as I strongly believe that competence is the prerequisite for high quality and safe care.
Mhm.
And I think everyone would agree that we would not want to receive a care from a hospital or from healthcare professionals who might put us at risk for harm. Like I would not want to go to a hospital when I know that the staff of these hospitals actually have a lot of incidents of harming patients.
Right.
And I think we have to understand that the healthcare setting can be a very complex environment with a lot of opportunities for mistakes. And
Yeah.
you might have heard of the report from the Institute of Medicine to Err is Human, wherein they revealed that there were 98,000 deaths per year that could
That's a
have
lot.
been prevented.
Yeah.
And
A
one
big
of the
number.
factors that led to this one is competence of healthcare workers.
Mhm.
So, this gives us an idea of the significance of competent care as it translates to safe care. Because if we have a healthcare workforce that is equipped with the knowledge, the skills, and the attitude to deliver competent care, then we can minimize the risk of harm and avoid preventable deaths caused by errors and incompetence.
Yeah. No, it's so true, especially in today's nursing climate. I think with nurses just being so overwhelmed with high patient ratios and just the influx of patients we have right now from COVID, it's sticking to your guns in terms of competency and not cutting corners is really where you have to stand in your own license. Really, I mean,
True, true.
yeah,
I
it's
totally agree. It's quite challenging, to be honest. For example, in based on what I'm seeing in the current scenario now, because the patient ratios have been massively disproportionate. Like
yeah,
in a critical care unit, for example, wherein we usually have 1:1 or 1:2, now you have 1:3 to 1:5. So
hmm,
sometimes it's what you said. Some nurses might consider cutting corners so that they can just finish the task.
yeah,
So that's why it's really very important to make sure that everyone in your setting is competent.
yeah, yeah. I mean, it's nurses I've seen really have had to come together because you have to rely on your unit as a team. No nurse is an island onto themselves right now, so
Exactly.
it's definitely challenging. I mean, I haven't been at the bedside for about 5 years now since we started a family, but my heart goes out to all nurses that are working at the bedside right now because they face a lot of challenges and decisions, and I hope, for any of my loved ones that end up in the hospital or patients out there that, they're making the right decisions there in the face of huge amounts of pressure. So
Exactly. Totally
yeah.
agree.
Yep. Well, we've reached the end of our questions. Is there anything else that you'd like to talk about? Any current nursing issues? I know we've talked a lot about education, which I am such a fan of. I think that is such a important part of nursing, to be a lifelong student, as you said. Find people that motivate you, find mentors that motivate you, and to keep yourself moving forward in the profession. There's so much you can do with it. So if you start to feel stagnant, to give yourself permission to move on and to find the people around you that can help you do that.
True. So I think we've touched base with everything, but maybe I would just maybe would like to say to all the nurses out there, especially now with the current environment, that as much as it can be difficult, always try to reach out and ask for help. Because maybe sometimes they feel like I don't want to be seen as weak or something like that. It's okay to ask for help. We are all humans, and the current environment for nurses is really very challenging. It's very difficult to navigate on your own. So yeah, just seek that help if you need. And for sure, other colleagues will also be very happy to help out.
Yeah, that's such an important message. Such an important message, and a great place to leave off on, I think.
Yes.
Awesome. Well, thank you so much for your time and for rearranging your schedule a few times. I know we had with our time difference challenges, but we made it work. So I really appreciate you taking the time to speak to all the nurses out there, and I know they're going to find a lot of motivation. It makes me want to be like, ooh, in terms of what else you can do with your career. You never know, like you said. So.
Yeah, no, thank you so much for having me. It's a pleasure to be here with you today and to be with NurseDeck as well. And I will definitely promote NurseDeck as a platform for nurses to go to, because based on what I've seen from the website itself, there's a lot of stories that they can relate to and they can learn from.
Yes, we need the more voices, the better. That's what makes us strong. So
Exactly.
Wonderful. All right. Well, enjoy the rest of your evening. And we'll be we'll be in touch soon.
For sure. Okay. Thank you so much, Brianna.
Nice to meet you. Take care.
Nice to meet you too. Bye-bye. Have a nice day.
You too.